Timothy Cooke, thank you for joining us here at BioFuture. I was thrilled to just interview you on a great panel about Lake and Nona, a very unique place. You are Medical Director, CEO of the VA system in Orlando. Tell us a little bit about why it's so important that you're down in Lake Nona, and what is that collaborative spirit that you feel in your institution and the ones you partner with?
Yeah, sure. For me, being part of that Lake Nona movement was an invitation, as I see it, to the VA to be able to help our veteran community in a very new and innovative way, to build a brand new hospital where none existed, to come up with the ideas that previously could not be done if you were just renovating a hospital or moving it. This was purposely built for that innovative spirit. And to partner with somebody so committed to that as the group there, and the partnerships that are there with the University of Central Florida, who is our main affiliate partnership on the future of healthcare providers in our community and the rest of the United States. The nursing programs and the education that we get the benefit from for those in our community, as well as the really stirring partnerships that come with other healthcare systems like HCA or Nemours. They're brilliant at what they do. And the VA is, I think, complementary to that and allows us to say, well, what do you do? What do you do? And how can we learn from each of them? And then there's the technology partners, people like Verizon, people like J&J, people like even KPMG. And I say even like KPMG and make it sound like it's nothing significant there, but when we think about what their responsibility is in this partnership of innovation in Lake Nona, it really creates this wide open spirit. Like, what do you do? How do you do it? And I always find the best innovations come from industries that are not related to healthcare.
Yeah, absolutely.
And so the surprising part of this, it shouldn't be surprising at all, that good things happen in a mixed environment,
the other thing
not strictly healthcare.
I think the other thing that surprised a lot of our innovation-invested audience is just how much innovation came and comes from the VA system. Talk a little bit about that. I thought there were some unique things you said.
Sure, yeah. I believe most people just assume that now that the technologies are well established, that someone in the private sector invented these things. The cardiac pacemaker, radio immunoassay, right? Being able to find out what the core pieces of healthcare are and bring them to the VA. Liver transplants, first perfected in the VA. Cardiac surgery involving parts of the heart being added to that, again, successfully done at the VA, and many, many, many more things like post-traumatic stress. Again, one of the fundamental things about serving in the military is that it exposes you to trauma, and those traumas are not uncommon to the community. First responders have trauma, others have trauma, and we've now created something that didn't exist before. That VA fundamental spirit of improving our veterans' mental health was the genesis for what came next. And again, those using the technology now and building upon those original innovations is something that I think is one of the most exciting parts about being part of that VA.
And I bet you're excited when you look at the next 3-5 years, a host of other opportunities in the healthcare space where I think the VA can be an innovation catalyst.
Clearly, and what's brilliant about the Lake Nona model is that every partner works together. There's no seams that pull out when someone says they need something or they would like to have you involved in whatever their next generation is going to be. So that's the feeder that I know is going to bring more people, more talent, that can only benefit us all in the long run.
That's a synergistic, inspiring component. Well, I want to thank you for sharing the successes, sharing your vision, and we are thrilled to have you here at BioFuture, so thanks.
Thank you, Jeremy.